Hey there, everybody. This is JR Burgess, and I'm here with my friend Dan Ritchie, an expert and leader and co-founder of the Functional Aging Institute. I've worked with Dan in masterminds for numerous years. I'm an advisory board member with the Functional Aging Institute. They've done so much great work in the industry to help people that are in the boomer niche, help understand safe and progressive exercise and teaching. How do we bridge that gap? So as a medical provider, just like you that are coming to this conference, how do you have trust in sending your patients to people that could truly change their life? So Dan, welcome. I want to introduce a little bit about what you do in better words than maybe I said and what you're presenting on here.
Yeah, so excited to be here and looking forward to your conference here in just a few weeks here in September. Really excited to share the massive opportunity in fitness and health working with boomers and seniors. When we think about just the baby boom generation alone, we're talking about 76 million people still living today between the ages of 54 and 72. These are our new seniors, right? Don't call them seniors, but there are new seniors, 10,000 of them every day turning 65, 10,000 of them every day turning 70. And there's a massive opportunity, I think, to add to your medical practice through fitness. Just a huge opportunity, right? They want more than just a prescription or a pain management. They want to be the best they can be. And so one of the big things I'm going to be talking about at your conference is how do we market to them? How do we attract to them? And how do we sell them function? How do we sell them longevity? How do we sell them the picture of the best version of themselves, right? Because the reality is most of them don't really want to buy fitness, JR. What they want to buy is this idealized version of aging, right? Like, I don't want to age like my parents did, right? Don't call me a senior, right? My mom's a senior, right? In fact, some of them will tell you, I don't plan to ever grow old, right? We want to tap into that, right? And be like, well, you know what? If you really want to stay young and productive and vital, then you need some level of fitness in your life. And so you need to jump into a medical fitness-based program that's going to allow you to maximize your function into your 80s, 90s, and even 100s.
Absolutely. So one of the main concerns when we're speaking at conferences, doctors are sometimes a little fearful of prescribing medical fitness or exercise, because that's not how they were trained in med school,
Sure.
Or B, they don't have time to do it, or C, they don't know the right people to refer to. So people just like you and I are out there trying to bridge that gap to create a higher level of trust between physicians and trainers by teaching them safe and progressive exercise. So you know exactly that it's okay to send your patient to a functionally aging certified trainer that are equipped to handle that. Any dialogue or insight you could give or recommend to providers that are resources where they can find your certified trainers that are equipped to handle these patients?
Yeah, so there's really two things. One is if you're not bringing fitness or some sort of medical fitness component to your practice, you should consider that. We actually have a model that can help people with that. So we have an entire business model called Ageless Fitness. You know, if people say, hey, I want to actually be training people in their 60s and 70s through my business, we can help you with that. But at the very simplest, we can help you find a functional aging specialist in your market, right? I mean, they're just take Minnesota, for example. They're all over the Twin Cities, right? I mean, I can literally throw a dart at the dartboard of, Minneapolis and St. Paul, and you can find a functional aging specialist. So this means the trainer's been trained with how to work with the 55 plus population. So if they've got medical issues, they got orthopedic issues often, right? They got arthritis, maybe joint replacements. You can send them to this trainer and they're going to actually have a philosophy. They're going to have the functional aging training model for how to train them. So I know the biggest problem, I think, in the past is the medical professional is scared to send their patient to a fitness trainer where they might get hurt, and that's a valid concern. And so you have to find a professional that knows what they're doing, knows how to handle this, or add it to your practice, right? I mean, let's add the whole fitness component right to your practice. So,
there's a recent study that came out about 8 years ago that it said by 2024 that every medical and healthcare system is going to have a program related to lifestyle or functional or nutritional components, based on the obesity crisis, the chronic epidemic, and where we see the proof of that. Just in 2018, this year, they launched the diabetes prevention program. So we see not only people that have disability or can't afford insurance, but a large part of that problem that our population that's CMS and Medicare are the retirees. And so for the first time, insurance is paying for preventative exercise and nutrition. So having a program inside your practice when healthcare and getting in front of this is a massive opportunity, especially with the aging statistics that you've shown right there. That's where half of our wealth, that's where half of our population is going to be.
Oh, so, yeah, absolutely. Yeah, 2024 is an interesting year, right? That's the first time when Gen Xers start turning 60, right? So people think, oh, the seniors are a niche, right? Oh, the boomers are a niche, right? It's like, in 6 years, Gen Xers are going to start turning 60 years old, right? I mean, it's absolutely crazy. So there's a whole nother wave of seniors coming, right? And you're right, by 2030, the percentage of people in this country over the age of 55 is going to be so staggering, but also the healthcare issues in that age range are going to be really, really staggering as well. And so there's a huge need, which means there's a huge opportunity. Fortunately, this population actually has quite a bit of wealth, quite a bit of spending power, and they want to improve their health, right? So if we offer services that actually help them improve their daily living, help them improve their function, help improve their quality of life, that's something they're going to want to actually purchase from us. So, so whether you do it in-house, whether you find someone to refer to, it's something you need to be adding to your business for sure.
Absolutely. I know I've been to your conferences, I've seen you speak, and you have some amazing transformation stories. Some people that are 90 plus years of exercising, does one or two patients come to your mind so you can show the doctors the possibility of, we don't have to run from this population. We can actually help serve them on a high level. I've seen some of your people at 90 years old throwing kettlebells and doing things. That it's not something you do on workup one, but right. These are people that have been training and worked their way up to this when they have the right structure around them.
Yeah, I mean, Joanne comes to mind right away, right? Here's a gal who came to me at 80 years old, and her dream was to go to the Galapagos Islands before she couldn't go to the Galapagos Islands, right? I mean, it was sort of like, this is the last big thing on my bucket list that I want to do before I can't do it, right? And, oh, by the way, I have Parkinson's disease. And, oh, by the way, I can't walk a block, right? And I want to go to the Galapagos Islands, right? And so in 6 months, we were able to train her to get ready to go to the Galapagos Islands, which is not that robust a thing to do, right? She said, I basically need to be able to walk a mile on uneven terrain, right? I need to be able to climb in and out of a rubber Zodiac boat, right? So she has to have some functional ability, right? And we were like, absolutely, you can do this, right? The fact that you're 80, not an issue. The fact that you have Parkinson's, not an issue, right? And so we trained her to do that sort of thing. And so we can give people their dreams, their hopes, their bucket list items, and we can work around their medical conditions. In Joanne's case, she had a pretty serious medical condition. Her balance wasn't good, her gait wasn't good. And so we trained her to be able to do those things. And that's the beauty of it, right? In the end, it wasn't about fitness for Joanne. It was about, I want to go on this trip, right? Like, I want to go take pictures of exotic animals and see really cool things, right? And so she just had to have a functional ability to do that. And so I think we can add that to many more medical practices, either through referral partners or small pieces right there as part of the business, right? Which is going to increase your revenue substantially.
What's that one quote I've heard you reference a few times, and you had that nice inspirational video of that gentleman on the motorcycle and everything, that it's not how you live to 100, it's something and something, it's the quality of life at some time. I just completely botched it, but I remember hearing each time I hear you speak, and I'm like, I love that.
Well, I think what you're getting at is it's not so much about living to 100, it's are you going to live well to 100, right? Yes. Because the reality is, I don't know if you're going to live to 85 or 90, but if you live really, really well to 85 or 90, that's what you want, right? You know,
that's longevity and health.
Yeah, I mean, I think Banana George Blair captured it, right? I mean, he died at 98 years old. But a couple weeks before he died, he was out water skiing, and he was a bit of a show-off. He was out water skiing barefoot, right? At 98 years old, right? We're like, holy cow, that's crazy, right? It's only crazy because we think 98-year-olds should be frail and weak, right? But I don't believe that anymore, right? Because I see inspirations like him and I realize, holy cow, I'm going to be doing amazing things at 98, right?
Yeah.
You may still be out there on the softball field in your 90s, JR. It's possible.
I need that. I got to get there. We'll see. I told my wife I may have to put that on the sideline unless I can get healthy again. So
Right.
I'm going to make that was my promise is
no more
My
injuries.
life, but I got to get healthy before I play again.
That's right.
But that's what medicine is exercise and nutrition has too long been siloed. But healthcare, anything absent of exercise, lifestyle, movement is sick care. And that's why the chronic disease, chronic pain, chronic injuries are rampant in these states. So when we can combine these forces, that's how we live to 90 healthy and optimal. I know you're doing two main things at our summit. It's your first talk is in the morning, and then you have an FAI certification for trainers, physical therapists, health coaches, so they learn how to properly work with anybody that's in the aging population. And go ahead and share a little bit about those two talks and what that could do for these practices.
Sure. Yeah. So Sunday morning, I'm really going to dive into the huge business opportunity that there is that we're really not tapping into, right? The fitness industry is not reaching it, not serving it. The medical fitness industry is barely even touching it, right? I mean, I'm going to show there's this massive economy, the third largest economy in the world, that we're virtually ignoring for some reason in the medical fitness and the fitness industry space. I don't know why that is. And then I'm going to show you how you can grab your piece of that massive economy. In fact, the baby boomer economy spends more money on consumer spending. This blows my mind, JR, on stuff they just want. Consumer spending is larger in that age range than the entire country of France, right? I mean, it's mind-boggling when you think how much they're just spending, right? And then Sunday afternoon, we're going to do the functional aging specialist, which is the workshop for fitness professionals, personal trainers, chiropractors, physical therapists, anyone who wants to help. I usually say people 55 plus, though what happens is you find, wow, a lot of this functional aging training model really helps people in their 30s and 40s move better, right? I mean, we would use the functional aging training model for someone like you who says, I want to play softball and not get hurt, right? It's like, well, you're not really moving in a optimal functional way. In fact, the way you probably, if you'd been looked at, somebody would have said, you know what, the way you're moving and running and changing and cutting is going to set you up for injury, right? And so this training actually helps someone that trains people of all ages, but the focus is 55 plus. How do we get people functioning well, right? Because I look at it as, hey, I know people that are still playing softball in their 50s, 60s, and 70s, and they go pretty aggressive from first base to third base, right? And they want to catch those fly balls on the run, and they want to play just as hard as you do, and they don't want to get hurt either, you know. So we got to make sure we're training them for high levels of function, for speed, for power, for all those things. So that's a fun afternoon. As a bonus, they get the entire online certification, which is about a 12-hour course, plus all the CECs, continuing ed, that goes with that as well. So a nice bonus tack onto that afternoon workshop.
I think you had a great point is they don't know, they may know that the wealth is there, but I think it was one point that you made early. They failed to learn how to message appropriately to that audience. So right. They said, just like you said earlier, they say the inflammatory words of not how people feel about themselves. So I think people want to work with them, but how they're messaging is just completely opposite of truly what they really need to be reached with. And right. I know you do a good job of breaking down some of those words and destroying some myths and some, communication errors that you would think are all right, but it's really doing a disservice if you're really trying to attract that population.
Yeah. One of the big things I talk about, and I'll probably spend about 15 minutes on my talk, is talking about the myth that the mature market wants fitness, or that the mature market will respond to fitness marketing. The reality is they don't want fitness, and they don't respond to fitness marketing. In fact, most of what we market in the fitness industry actually repels people over 55. In fact, they see it and they go, that's not for me, right? And so we have to be smarter about how we market to them, reach them. Otherwise, we become a self-fulfilling prophecy, right? We're like, the older market doesn't want to respond to fitness marketing. Like, no, they don't want to respond to fitness marketing. They want to respond to something completely different, and we have to learn that. And I'm going to teach you that
And there's the truth to that, because you have a thriving practice. You've helped hundreds of people get this certification. You coach masterminds, and there are people filling up their gyms with this population, and
Yep.
it touches their soul. It's meaningful. These are lifelong friends and relationships. So just to Dan's point again, is there's the market out there. You just got to learn how to connect. And when you come to the summit, I know Dan's talks are fabulous at learning how to message the right way. But this is also the Cash Practice Success Summit. So I know you're world class at both business and of how to teach trainers and health professionals how to operate this. But we ask all the speakers to try to be raw and relevant, meaning we all started in business at one point. I believe all medical and healthcare professionals went into this industry because they love to help people, they care, but then they get into cash, or when they want to go onto their own, they're like, oh crap, I have to become a marketer, a salesperson, or learn this business stuff. Can you take me back to when you first got hit with that ton of bricks that, okay, to get where I want to go, I got to learn this side of the coin?
Yeah, it was probably, we opened in 2007. It was probably about 2008. There was a little bit of a bump in the economy. In fact, some of our clients took a 40% hit on their portfolio, right? And so, when you have millionaire clients all of a sudden saying, I'm not sure if the sky is actually falling, but it feels like it, right? And you realize, I'm going to have to get better at marketing, and I'm going to have to get better at sales, because what used to be easy is no longer easy, right? What used to just be, hey, I know how to sell training to wealthy retirees, all of a sudden got tricky when people were like, I don't know if my wealth's going to be here tomorrow, right? And so when the economy sort of fell apart, we realized we're going to have to market better, we're going to have to message better, we're going to have to communicate better, and we're going to have to sell better. We had to get better in all those areas. We were really good in the training and getting people results. We weren't as good in getting people coming in the door, and we knew we had to get better at that. That was a huge learning curve for us. And that's a lot of what I'm going to teach actually in my talk. What we started to learn over the next 4 to 5 years was the best way to message. Who was our ideal client? Who's the best next customer? Where are they? Where do we find them, right? Because you can start spending tens of thousands of dollars in newspaper advertising and internet marketing and all sorts of things, and all you're doing is just throwing stuff up against the wall and hoping it'll work, and that's not a very effective strategy. So I'm gonna really teach a lot of what we learned the hard way. How to effectively target the customers you really want, how to reach them effectively in a very low cost way.
You said something incredibly important, and this is a lesson I teach all the time. A lot of people want to be business owners. They want to run their own show. And what you said, and same thing what Joel and I had going really good, is results. If we are talking about building a business, going to entrepreneur, it's going to do you horrible things if you're out of business in 3 years, to your stress, to your family. The foundation, I strongly believe that if you don't get outcomes, that skills training, learning how to coach is critical to the foundation. So we have half the summit dedicated to that. And then it may be time to go into practice and follow improving models. But that's where we work at the Gold's Gym. Be employed and be an amazing employee and active integrity, and learn the skills necessary, because there's so many people out there that just want to go, they're starting online businesses. And if they haven't got that skill of how to retain, how to market and coach, yes, you can market and grow a business, but if you don't help people, you don't survive that way either. So meaning we're talking about how do we survive? It's yes, anybody that puts their emphasis into marketing and sales full force can end up getting some business, but you'll get found out fast. Results, then learn how to market and scale and grow. And that's to the last question. Thanks, Dan, for bringing that up. Such an important component is you are running your own gyms. You have your FAI certification. You run masterminds. You're kind of like what we are. We got a lot of things going on. And we're talking about, what about now today is that key for you scaling and growing? I know you have a family of 6 kids, right?
Five kids.
Five kids. It's Cody that has 7, right?
Yeah, Cody has 7.
Okay, so 5 children. You're a busy professional. You try to do the best you can to juggle. What is that scaling growth challenge of running those 3 businesses and continuing to have your family, your health, your balance, have income that is allowing you to have impact worldwide? what is that next key and continued area of focus for you to be able to continue to grow and have more impact?
Yeah. I think for me, it comes down to two things. One is knowing what are the big levers for me to be working on, right? And so I think about sort of the 5% versus the 95%, right? There's a ton of stuff that has to get done for Functional Aging Institute to move forward. But most of that stuff I don't have to do, right? Somebody needs to do it, but it doesn't have to be me. And so a big thing with me and Celia's my executive assistant, and then Cody's my business partner, is for the three of us to constantly be reviewing that every 60 days or so, right? Like, what are all the things that need to get done that actually Dan has to do? And what are these things that Dan is doing that actually can be moved over here, and Celia can do them, or Celia can hire a virtual assistant, or Celia can hire a Fiverr, or we can send to our web team, or we can have a master trainer do, right? Like, I don't have to go to Omaha and teach a workshop. We can send Diane to go do that, right? And so getting more and more focused on what are the big things that Dan has to do, right? And so most of those are creating content, speaking at conferences like yours, and leading masterminds, right? Celia can't do those things, right? But she can do it just about everything else, right? She can hold your hand through the certification process. She can find you a trainer in Wichita, Kansas. She can connect you with just about anyone around the world who's a functional aging specialist. We're in 18 countries now. And so I don't need to do those things, right? I need to do the high level things that keep us moving forward. And I think what happens is as your company grows, there's more and more and more and more and more stuff that's filling up on your list, right? And all of a sudden, you know, JR is doing all these things and you're like, wait a minute, a lot of these things should be over here on my assistant, right? I don't need to be doing those, because guess what? If you're doing them, one, you're taking a job away from someone else, but you're also doing a job that isn't moving your company forward, right? And so sometimes we start with just looking for things that are like $10, $12, and $15 an hour tasks, right? Like, I don't clean the toilets anymore, right? I've done it, but I don't clean the toilets anymore, right? In fact, my staff knows if I have to go out and buy toilet paper because we ran out, that's a huge waste of my time, right? Like, it's going to hurt them, right? So if I'm doing tasks that somebody else can do, now it gets harder when these tasks get to be like $50, $70, $100 an hour tasks, right? Yeah. And I have to realize that's not good use of my time. Somebody else can do it, right? And so that's been the big thing for us, and consistently looking at that every 60 to 90 days to make sure I'm doing the big things that move our company forward.
Yeah, I call it reverse engineering. Somebody really simply told me, JR, what income are you trying to make? And let's just say that was $500,000. And if I'm doing things that are less than $250 an hour, that's either got to go to somebody on my team a mistake. Otherwise, it's very difficult to get there. And that's hard because, you know, we want to control it all. We want it done a certain way. A lot of health professionals are perfectionists, and you got to let go of that rope in order to scale and grow. And that's a point of emphasis. And here's where sometimes the mind has to shift, is not just that task, but more logical of what you're doing. So meaning, in order to grow, at one point in time, I gave value to everybody. I do free consultations, giving away time. And I believe in that philosophy. I believe we got to be value providers and go-givers. It's still one of my favorite books in the world. But when I'm capitalized and working 90 to 100-hour work weeks to try to do it, one of my mentors, Mike, told me, JR, when you say yes to those things, you're stealing time from your family. Yeah, and that was like, wow, I want to be there more for my kids. I'm stealing. It's not that I can't have the other people do those things of value, because I believe that's why we are where we are. But at the same time, I got to protect and guide that time and stick to those hour requirements, have the assets, the done free things that don't take one-on-one time. But if you are doing your time for free and not where you want to be, it's very difficult to get there. So even though that's a philosophy I believe in, it's a philosophy that I now have to shift away from to get to the next level.
Yeah, or you have to balance that, right? So I'll do a certain number of free calls a month, right? Mm-hmm. But if I did all the free calls that people wanted, right, I would never see my kids again, right? Yeah. I mean, I'd be on the phone, I'd be on Zoom, I'd be on interviews all the time, right? I mean, there are always business owners looking for help, looking to pick your brain. If you and I were always giving away free consulting and coaching, we'd never see our families again, you know? So there has to be a limit. There has to be a balance. And at some point you have to say, okay, these are the most important things that are going to serve my business, but also serve those that need help. And you might say, well, you know what, 5 times a month, I'll give 20 minutes away, right? But that's
Plan,
it.
though. That's next level skill. And
Right.
you've blocked that, you've made time for that.
Right.
And it's no different from medical care. It's all right that, okay, you have a cash practice and you're worried about charging you can have your pro bono pieces in there and things that feel good and slot those patients. But your other slots, you have to generate X amount of revenue to reach the goals that you want to do. So amazing, amazing point. Dan, I'm so excited to have you here. Our guests should be excited too, because you have so much wisdom, value, and can help them. Not everybody's going to be able to come to the summit. We'll put a link below this interview for you all, but where do they reach you? If they not, how do they get in contact with you? Because if not, I still want them to go do your certification. You're all around the world.
Sure.
Go to your main event. We're talking right now, how do we coordinate and add some things to it, but where do people find you?
So functionalaginginstitute.com is the simplest place. You can hop on there, see our upcoming workshops, check out our courses, grab our starter kit for free. You can contact us directly. You can even find a world map for functional aging specialists in your area. So functionalaginginstitute.com is the simplest place.
Yep, and at our summit, we're doing a bonus gift because we believe that trainers and health coaches and fitness professionals are the key to unlocking healthcare. If they sign up for your certification, which there's a link on the link that we'll put below, if you're a personal trainer, you don't have to pay the full $9.99 price that the doctors are paying. You pay for the certification, and we're giving you free access to the summit just because we know these doctors that are going to be adding medical fitness and component. That's why I love being involved with you and coming speaking. When I find a doctor that wants to add medical fitness in Orlando, my first call wants to be Dan and saying, who are the functional aging specialists that not just have gone through the course, but now are a results-oriented trainer and that have learned some of the business skills necessary to grow these medical practices so we can work together to redefine healthcare. So thank you all so much. Get to this conference, look at the schedule on the FAI website and get here because this is truly what we talk. It's not just about results. We got to learn the whole comprehensive aspect to truly have the maximum impact if that's what you're looking for. So thank you so much for your time, Dr. Dan. I really appreciate it, and we'll see you in September.
Sounds good.